I did not receive informed consent before I became physically dependent on baclofen. I encourage people to report psychiatrists because, doctors mess up and they should be held accountable. I was on a hold at 16, and my parents supported me leaving the psychiatric hospital against medical advice because the psychiatric hospital was profoundly detrimental to me. I learned from other kids how to, use dental floss to harm myself. The kids, encouraged each other to self-harm.
Welcome, everyone, to the amazing show on the One Moment Podcast. I am your boy and your co-host, KO, and got a very interesting and a very amazing young lady on the show. Now, back in the day, I used to have to hire people like her, to keep me from going to prison and jail and all that, and to keep me from getting, some pretty decent rap sheets. So I am privileged and honored to have this young lady on the show. Now, with that being said, I do want to start off with your people might be, triggered by things they hear, and that's okay. It's, life is full of triggers, right? So if you need help, please reach out immediately to somebody that you trust, somebody, use your resources, talk to your psychiatrist, your therapist, go to an emergency room if need be, go to a crisis center if need be. You have 911. You also have 988, which is the National Suicide and Crisis Hotline. Then you also have many, many more tools that's not also related to the medical field and the healthcare field as, in general. There's many tools, many resources out there. So please utilize your resources. Doesn't matter if it's a 12-step meeting or what have you. Right now, since we got the disclaimer out of the way, right, let's get to why we're here. This young lady, she reached out. I think it was sometime in end of January, beginning of February, or maybe right after I had surgery in February. And she's been following us for a while. That was very interesting. And she reached out and was like, "Hey, I want to be on your show. I love what you do." And so we started talking, and I think when we finally started talking, it was around the state conference I was at in March or April, down in Asheville. So we sparked up a conversation, and I love what she had to say. And I think we have a lot of similarities in common. So with that being said, let's give it up for Miss Ellen. How are you doing, ma'am?
Doing well, thank you. I hope everybody else is doing well as well. And I would, endorse, if you're struggling, you can always reach out for help. You never have to carry burdens yourself. You're never alone.
Absolutely.
If you feel you need help after this, get that help.
Absolutely. I could not agree more. And just for the audience who don't know who you are, where are you calling in from?
I'm in Metuchen, New Jersey. So we're half an hour, 45 minutes from New York City.
One thing I don't like about Jersey, as some folks like to say, you have the Jersey Turnpike, and it's almost like Texas. Doesn't matter how fast you drive, it's going to take you an hour and a half plus 2 hours, I think. Well, it's been a while since I've been on the Jersey Turnpike. Doesn't matter. You can go 85, 45, 55, 125. It's still going to take you an hour and a half plus to get across that doggone turnpike. And like I say, it's been a while, so I think it might be like a 2-hour drive. So whatever that drive is, it's going to take every bit of it.
I'm not big into long drives, but yeah, I do it when I have to.
Right. So, we're here because, the goal on our show is to help, make change where change is needed, right? Whether it's in a different country, whether it's in somebody's home state, whether it's in the U.S., Canada, it doesn't matter. Doesn't matter what it's related to, whether it's LGBTQ concerns, African American concerns, women health, men's health, what have you. And we were talking right before we hit the record button, right? And we were, man, like, I had to hit the record button because we were about to go deep with it. So I wanted to talk more about what we were just talking about, because that's why we're here anyways, is to talk about the healthcare field, or the field of healthcare and the concerns in the current state of the system. And it's sad on where it's at. And I just want to throw this
No, it
phrase
really is. I firmly believe we need to have reforms for our healthcare system to make it, more transparent and more accessible to everybody, and to have
Absolutely.
parity for mental health, because people pay more for mental health services than for, if you had cancer. And I don't think that's appropriate. I think we need parity.
Right. Right, 100%. One of my things is things that I've realized, and we were just talking about this too, is there's a lot of lack of transparency in behavioral health. There's a huge deal in the healthcare system as a whole, and especially in behavioral health, regardless of whether it's mental health or substance use or what have you. There's a pill for every ill. And I think it's even gotten to a point where many people, regardless of who you are and what your struggles is, let's say it's chronic suicidality, right? Or suicidal ideations. Well, there's not a pill that we can give to take away thoughts, right? Like, thoughts are just thoughts. And, and I think that the healthcare field is pushing ever so faster to this ideal of a pill for every ill. And even in substance use, right? Well, just prescribe Suboxone, just prescribe methadone, just prescribe this, just prescribe that. And it's like, whoa.
So, I freely admit that, in benzodiazepine withdrawal, one of the things that I and many others, I am intermittently suicidal. These are not things that I do anything. They're just like you have a bad thought. And, this is not something that merits commitment. It's just like, okay, for a moment, I'm thinking something negative. And, a call to 988 to a friend relieves that. These are things that many people are afraid to say out loud and sit with. And I firmly believe that that is detrimental.
Yeah. No, absolutely. And, because there's not a pill that we can take to stop a thought. It's not a pill that we can take to change a thought. It's about utilizing, the resources and tools. And it doesn't matter, benzodiazepine, whether it's alcohol use, opioid use, whether it's schizophrenia, whether it's bipolar, depression, anxiety. I mean, you can take medication to help, try to rebalance some of the imbalance of the chemicals, right, of the circulation of the nervous system as a whole, right? But a thought process is a thought. You can't just up and change that and be like, hey, here, take this red pill, you'll reset your whole thought process.
Right. I mean, the pills, helped me very briefly, but very quickly, my tolerance grew, and, pills, benzodiazepines were profoundly harmful to me. I've been a long-term insomnia. I'm lucky that that is my worst symptom. There are many suicides, many people have seizures, many people have akathisia, which is inner restlessness. People spike crazy high blood pressures. Because I have resources, these are things that are unlikely to happen to me. And because I have doctors who trust me that I'm not an addict, that I've never misused a substance, I've never smoked a cigarette, never used an illicit drug. But many people are not lucky enough to have doctors who trust them. And this is a process, getting off psychiatric medications is something you have to do very carefully, with a doctor.
Right. And I think it goes back to, you have to be able to trust your healthcare team.
Yes, definitely. I used to be in a group where people were encouraged to lie to their doctors to get off psychiatric medications because they did not have doctors who trusted them. And this is the dynamic, that is very unfortunate, that people who want to get off psychiatric medication would have to lie to their doctors. But because there are so many people who do not have doctors who trust them, that is something that happens all too frequently. Because people do want off of psychiatric medications, and often doctors are reluctant to take them off because they are worried about liability.
Well, Well, it's like a buddy of mine says, if you work in healthcare and you carry your own liability insurance, your insurance should know you by name.
Mm-hmm. Yeah, no, I mean, definitely no. I completely agree. No, you need to be careful about being insured. If you're going to be a healthcare professional, you should be insured, because you could be sued, because healthcare providers mess up and they should be held accountable.
Right, right. And it reminds me, right, when a medical provider cannot trust a patient, it really makes me think of how antique the system still is. Because think about it for a moment, right? What happened? Like, let's look at the history of ethics, the history of informed consent, the history of all of this, right? Because this is where lack of trust still continues to go back to, right? On both sides here, trust in the healthcare system and also healthcare system not trusting us.
Yeah.
If you look at the things like the Tuskegee syphilis study, right? And this is one of the biggest ones in U.S. history, is, we took African Americans, gave them syphilis, studied them, and when the cure for, or the cure slash treatment for syphilis was, was found, we never provided it to them. Right. Like, that's where informed consent goes back to, right? That's just one of the reasons we have informed consent, is because of the historical damages that the healthcare system in the US has done to people. And, no wonder we don't trust the healthcare system. No wonder people in various positions, have this authority to make decisions and are protected and are not held accountable.
No, I mean, accountability is very important. I think I was talking before we went on recording that I filed suit against a psychiatrist.
Mm-hmm.
As an attorney, this is something that I can do. Most attorneys will not take cases against psychiatrists. I firmly believe that psychiatrists should be held accountable, as should any doctor. And because of the expenses of it, I was unable to find anybody else to represent me. This is a case, I firmly believe I did not receive informed consent before I became physically dependent on baclofen. I encourage people to report psychiatrists because, doctors mess up and they should be held accountable. I have reported 2 psychiatrists this year. That is something that anybody can do. One was an online form and one was something that I mailed in. That is something that should be accessible to anybody. If a doctor does something wrong, you should feel that you can say something. You don't have to sit there and say, okay, I'm going to take this. I think it's very important that people know that they have choices in healthcare.
Mm-hmm. Absolutely. Absolutely. And, this isn't even, if you work in psychiatry, you work in healthcare, what have you, we're not talking about, this is far from forced medication protocols, right? Like, there's a time for forced medication protocols, but
Right.
what we're talking about doesn't even border that area.
I mean, if you're openly psychotic, it's one thing.
Right.
If you're depressed, that is a very different thing.
Right. And this is what we're talking about, is those that aren't forced medication protocols, is when you're giving medication and you're not given the pros, the cons, the ins, the outs, all of that good stuff as far as like your healthcare needs. Does that make sense?
Yeah, no, definitely. If I'd known what would happen if I ingested benzodiazepines, I would never have taken them. I have suffered tremendously because of it. I was told that high-dose benzodiazepines are no issues, no problems. The warning generally given is 2 to 4 weeks or physical dependency may result. Who am I to say whether that will apply to me? For some people, they don't become physically dependent. For me, it happened very quickly. I have no issues with anybody else taking psychiatric medications. I just want them to ask the questions I didn't ask before they decide to do it.
Right. And I think that's really what it boils down to. So let me ask you this then, because I think it's important to know. What were you not told, right?
Right.
Before they, or as they were writing that prescription and saying, oh yeah, it's safe because that was like Tramadol, right? Tramadol is non-opioid, this, that, and the third. Well, let's look at the facts here. Tramadol attaches to the opioid receptors, therefore it's
Yeah.
an opiate, right? Same thing with Oxycontin when they first, put that out. Oh my God, it's not addictive. It's this, that, and the third. It's safe. It's one of the safest pain pills ever created and ever known to man, right? Well, come to find out, we are currently living and experiencing a major, wide-scale opioid epidemic because of the Oxycontin makers, because of what they did, right? Like this is a complete and utter violation of informed consent. So what
Exactly.
was your experience early
Right.
on?
So, I was a complete insomniac, and because I was an antipsychotic withdrawal. I'd been a complete insomniac for about a month. So I was desperate. And, I was offered various types of psychiatric medication. I wasn't offered anything else. I was asked if benzodiazepines had addictive properties, and I was told no issues, take these. I didn't feel comfortable asking questions at that point. If I had been, a good conversation would have been, okay, if you take these, your tolerance may grow quickly. You may become physically dependent within 2 to 4 weeks. You may become an insomniac. You may be at risk of seizures. You may have severe concentration issues. You may become suicidal as a result. These are risks that I was not disclosed at all with my mainstream psychiatrist, who said, here's a pill. This is the solution. This is, the only solution. Take this. Now if you have any doctor who tells you that a pill will cure a mental health issue, run the other direction. There is no cure for mental health issues. If any doctor tells you that they can cure your mental health issues, that's disturbing. Can pills help some people? Definitely. But there is no cure. There are things that can help. And you have to do the hard work yourself. I'm working very hard in therapy and working hard on myself to be there for anybody else, because the cardinal rule is always to choose yourself first.
All right, so let me ask you this, because you are right? I definitely agree. Self-care is the best care, as a nurse
Yes,
that I
exactly.
used to supervise used to say. And I always tell people, take your vacays, take your PTOs, take all of that, because the moment that you take your last breath, your employer is going to have your position posted within 24 hours. I don't care how good of an employee you are. It's a business relationship. Nothing against my current employer if they are watching. I don't know. Right. I love what I do. I enjoy my job. I enjoy my supervisors, my colleagues. But it's a business relationship. Like, let's look at the facts here. It's a realistic, conversation, right? And it's it is real. If I die today, right now, my job is going to have my position posted within 24 to 48 hours before I'm even cold, right? Before I'm even, before they do an autopsy. So, with
I mean,
that being,
all those attorneys working 80-hour weeks and pushing themselves so hard that at the end of their careers, they haven't taken any time for themselves or for their children. I
right,
don't believe that that's a good dynamic. You have to take time to enjoy yourself.
right. And so when you run into these issues where a provider is saying benzodiazepine is not addictive, well, this creates a whole slew of problems, including involving and interrupting the ability to self-care, right?
Mhm.
It creates problems with, many things, many dynamics here. But who in the heck would say, you know what? Let me rephrase this. Who in the hell would ever say that a benzodiazepine is non-addictive?
I don't know. I was told that, firstly, I'm physically dependent. I'm not an addict. There are two types of addicts. There are those people who are actually drug seeking, and seek benzodiazepines, and those are those who are cut off from benzodiazepines by their doctors and are labeled as addicts because they have to go seeking benzodiazepines on the streets. But I was told that I was lied to. I was told that benzodiazepines did not have addictive properties.
Mhm.
And I believed the system. I believed in my psychiatrist. And I'm not going to guilt trip myself because I believed a trusted physician from 25 years who had always told me, here's pills. Here's the solution to all of your problems.
Mm.
And I trusted. And these are things, there are so many people who trust. And I no longer trust. My best friend is more involved to make certain that I make decisions in my wise mind. I always encourage people to bring a friend or a family member into an appointment with them if they're not certain that they can make decisions in their wise mind. Because often you're pressured to make healthcare decisions, and doctors have very limited time, so you are pressured to make decisions.
Mm. Yeah. So what do you feel like besides that, right? Because we're talking about violation of informed consent here,
Yes.
which is a major, major healthcare violation, major patient rights violation.
Yes.
What do you feel like is one of the most critical things that needs to change in psychiatry?
Well, firstly, I think there needs to be more funding. Psychiatrists have 15 minutes. What can they do in 15 minutes besides push a pill? I firmly believe that psychiatrists mostly push pills and do not do therapy. Therapy should always, if you go to see a psychiatrist, they should say, have you seen a therapist first? There needs to be greater funding for therapy. I see many people who cannot afford therapy. For me, therapy is currently $15 an hour, which is very cheap. For many people, it is not accessible, and that is very unfortunate. I am lucky to have therapists who know about benzodiazepine withdrawal. Benzodiazepine withdrawal is something that is is fairly common, but people don't talk about it very much. I post public on 6 platforms, and there's nobody in my community who will even admit that they're in psychiatric medication withdrawal. So it is a very lonely place for me. These are things I firmly believe that should be talked about openly and transparently because prevention is so important. Because what I have gone through is almost 100% preventable, unlike cancer.
Mm.
Dietary changes in my childhood and therapy in my childhood would have made such a difference to me. I firmly believe I had autistic meltdown with high anxiety at age 20. And like so many others, I was misdiagnosed. I was diagnosed as bipolar 1. And that's a diagnosis that, I was told could not be changed. I think that misdiagnoses are rampant in this society, that doctors rush to diagnose you and to label you, which I believe is very unfortunate. I don't want to be labeled. I want to be a person.
Well, that goes back to a lot of the insurances here. Because the
Exactly.
problem
There's a code on anything.
Right. And insurances want to be able to pay, and they are only going to pay when there's a label.
Exactly. So,
I can't
I
go get
label
cancer treatment unless I have a diagnosis of cancer.
Yeah.
You see what I'm saying?
Yeah. Right. So you have to be labeled. So, the Diagnostic and Statistical Manual for mental health.
DSM-5 or the DSM. Yep.
Yeah. No, I firmly believe it's a made up piece of something. And most doctors I talk to believe that as well. They had to categorize people. They had to put you in little categories because, mostly for insurance purposes. And then people say, okay, I am in that category. That's who I am. That's who I'm, I have no choices. That's who I am. It is necessary for insurance purposes, but I firmly believe that it is fabricated by psychiatrists.
I wouldn't just throw psychiatrists solely in this book, okay, or in this category, because I've worked with many people. For an example, I've worked with many folks, many folks across the aisle here, from the rich to the homeless to the poor to the, well-known, well-established, and quite often, more often than not, I'll have an individual, for an example, a female. I'm gonna pick on the female population here, because it's more prevalent with on what I'm about to say here, and I'm not discriminatory by any means. I'm not trying to.
No, not at
all. But I've seen and met many women who have this diagnosis of borderline personality disorder, and then they'll have also a substance use disorder, right? And I never see the borderline. Never, ever, ever see the borderline. When I'm meeting with people who say they are borderline, I don't. If it's a true borderline, like most psychiatry, most healthcare professionals, I get this internal feeling that it feels like, the way I typically describe it, it's like Freddy Krueger claws coming in through my back and just ripping me apart, right? And I've meet these women, and they're amazing women. I mean, they're just phenomenal. And they might have a cocaine, a opioid use, or whatever, alcohol use, whatever, right? But I never see the borderline. I never experienced borderline. I don't see the symptoms of borderline,
and yet they have
this diagnosis, right? And I'm like, well, how come? And lo and behold, you have these mental health and medical professionals who are diagnosing this stuff, but they don't understand substance use disorders. And it's like, okay, well, why did you? And I always ask a patient, why do you have this borderline? And they'll say, yeah, my such and such gave it to me, and it's they said because of my lifestyle and how I was living and being, and et cetera, et cetera, et cetera. And I'm like, okay, well, let's look at it. Did you ever have, again, for an example here, did you ever have sexual promiscuity outside of active addiction? No. Okay. Did you ever have emotional dysregulation outside of active addiction? No. Did you ever have, and I'll go straight down to borderline symptoms. Right? Did you ever have this outside of addiction? No. How about this? And it's everyone, and I preface outside of active addiction. And most of the patients, almost 95+% of them are no, 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 no.
Exactly.
But they're getting the diagnosis, a pretty severe diagnosis.
And they say, okay, that's who I am.
Right.
I mean, I've had that happen to me. I was told I was bipolar. I acted the part. I was told, okay, that's who I am. The psychiatrist labels you and you say, okay, they must be right. I mean, I think I even looked up what bipolar 1 entailed. So I think that, being labeled as borderline is incredibly detrimental to somebody, because they think, okay, that means there's something wrong with me.
Right. Right. And, I love what you said earlier when we first started out. We're more than just a label. We are a human being. We are more than just an insurance number. We're more than just a piece of paper. And so when we go to see people, I think it really, healthcare professionals really need to take a step back and have that human to human connection first. Because once you throw a label on there, it's there permanently. You see what I'm saying?
It's very difficult to get rid of. My healthcare provider told me that even though 25 years later, somebody had diagnosed me as bipolar 1, and even though she had letters saying she'd never seen any evidence of even, mania for 25 years, she said she could not change the diagnosis because another physician 25 years earlier had said it.
Yeah. And the only thing that we can do is say that, to even try to correct it. And again, goes back to informed consent, right? Like all of this is informed consent. Is I have to document clinician assessed for and does not observe or has not observed any symptoms of, right?
Right.
So when you throw a psychiatric diagnosis on there, it's not like, oh, it's cancer, now you're cancer free, right? It's, if I assess somebody for, let's say substance use, borderline, ADHD, or whatever, and I don't see it, clinician assessed for or therapist assessed for, however, does not observe or something of that sort. We can't just undo a diagnosis, right? And that's what
Right. I mean, it's very hard to undo a diagnosis. I appealed my diagnosis and I was told it can't change. I've had other doctors who've looked at me and said, yeah, you're autistic, and have changed it in some of my files, because that is what I firmly believe I am. And, do I really care? I have minor sensory issues. I don't like going to the fireworks. It's not a big deal. I think there are many people who are neurodivergent in this society. And it's not something that bothers me very much. It's, I'm slightly different. It's okay to be different. Anybody should be okay being different.
Yeah. No, 100%. It doesn't mean that, there's anything wrong with this. And, I'm curious because when we talk about informed consent, right, this is a huge issue, right? You have people throwing the diagnosis up there and, you have the insurance company requiring all of this. And we're taught in school, you can't ever or don't ever give a diagnosis out. And if insurance requires it, go with the least first, right? So instead of giving a PTSD diagnosis, right? And I'm just using this as an example, and this isn't like set in stone across the board for everybody, right? Because if you have a military person and they're sitting in front of you, or somebody who was, been raped and some like severe trauma, it just doesn't fit, right? Because you're talking about complex. But let's say, it's a new individual, and instead of going straight out with a full-blown PTSD, you could do something like an adjustment disorder, right? And you can rule out for other things, because an adjustment disorder is less severe when compared to PTSD, borderline, all of these other diagnoses.
So, I've seen people who are reluctant to seek out therapy because they don't think that they could get any label. An adjustment disorder is something, anybody can have an adjustment disorder.
Right.
Everybody has struggled, and everybody should be able to reach out and get therapy.
Right.
Being told you have an adjustment disorder is, there's nothing wrong with that.
Right.
That should definitely be the first diagnosis.
Right. Right. No, 100%. And adjustment disorder, just for anybody who's listening, because I know we're talking about some we're using different things here, right? All it is basically, I lived in California for 35 years, and then boom, I end up moving across the country, new culture, new city, new everything, don't have any friends, right? And I'm having some problems adjusting to the new everything, right? And it's got to meet a certain criteria, like a couple of weeks or whatever, and I don't have the book in front of me to really read out, so I'm giving you an idea. You also have Z codes, right, that you can give, but insurance isn't going to pay for Z codes. A Z code is basically, I don't want to give a adjustment disorder diagnosis because it stinks, right? But I'd rather use it. But a Z code will be like, okay, social stressors, right? So it's less restrictive when compared to like a adjustment disorder, or financial stressors, right? That is what a Z code could look like. Is I'm not diagnosing you, you're just struggling with this at the moment. And again, it's a Z code is less restrictive, but get this, big pharma and insurance don't pay for Z codes.
Yeah, no. So no, you got to have a code that insurance will pay for, because I don't want to be hit with a bill that, I have to pay for therapy. I have to pay, $200 for therapy because the code was wrong.
Yep. Yeah. And all of this goes back to, guess what? The big two words, IC, informed consent.
Exactly. ask the questions I didn't feel I could ask. And there's so many people who don't feel they can ask questions. I now ask, 10 million questions. And if your doctor doesn't feel like giving you the time to ask questions, find a different doctor who will give you that time. Because, a doctor who doesn't let you ask questions, that's an issue. There are always choices in the medical system. There's always choices. You don't have to be driven to one doctor.
Absolutely. It's always a second opinion.
Right. You can always get a second opinion. If I had cardiac arrest, I might not be able to get a second opinion. But for anything else, if I'm conscious, I'm going to get a second opinion. Or, at least make sure that I trust what I am ingesting into my body.
Right. No, and I love the analogy there, and I wasn't laughing, at the situation, but it was funny, right? Because if I am in cardiac arrest, like the doctors are going to do, and the medical society is going to do what they need to do, right? I have a colleague of mine. She's amazing. I love her to death, and I'm not going to say her name up here because I don't want anybody to, it's her privacy and her confidentiality. So we were talking about different things, and I was picking with her. I'm like, I have what is it? A no resuscitation order or whatever they call it, right? They call it something else. It's a fancy name for it.
Yeah.
And I'm like, I have a no resuscitation order, right? And she was like, she literally looked at me. She was like, well, Kevin, I don't have access to your medical records, and if you pass out on this floor, I'm going to resuscitate. I'm going to do everything I can to resuscitate until somebody shows me an order, right?
Doctors are put in a horrible position because if they let you die, they're going to be liable. So I have a power of attorney, a legal document saying, do not commit me to a psychiatric ward for any reason unless I'm a danger to others, and to instead call my mother or my best friend in the case of a mental health emergency. I have never been a danger to others, and I don't think I would ever be a danger to myself sufficiently that I would merit being in a psychiatric hospital. Even minor hitting or things like that, they do not merit a psychiatric hospital. I do not believe that my power of attorney would be respected, but I firmly believe that psychiatric hospitals are not therapeutic. There are many more humane ways to treat a person.
Well, it goes to me, and this is just my belief here. Are psychiatric hospitals needed? Absolutely, 100%.
Yes.
But I also think it goes back to when we think about informed consent, right? There's not a pill for every ill. Just because somebody shows up and let's say there's a threat of harm to self or others, right? And there's an active threat. Like
that's
somebody's acting on it, somebody like all of this, right? Like, yeah, right. Like we most likely need some type of psychiatric stability, for a couple of days. Let's say there's some medication changes and somebody starts having some type of psychosis on an outpatient basis, right? Yeah, we need some type of inpatient psychiatric stability because we got to make sure that the healthcare is, that person's healthcare is taken care of. The health is there. There's a safe transit. Like we have to make sure, right? Because every person's different. And so when you start transitioning from benzos to something else, right? There could be some medical emergency withdrawals that needs,
definitely in some situations needed.
Right.
But if I have minor hitting, if I do minor self-harm for a second and I hit myself, that is something that my therapist can address. It is not something that merits a psychiatric hospital. If you go down to minor self-harm for a few moments, that's not the end of the world and doesn't merit your being in a psychiatric hospital.
Absolutely agreed. And too often than not, I see, when on an outpatient basis, especially, the patient shows up and says, hey, I'm suicidal, I'm thinking about harming myself. Well, let's take a step back and look at the big picture here. It's just a thought, right? And I'm not minimizing suicidality or suicidal thoughts, and neither is Miss Ellen, okay, by any
No,
means.
no, I mean, these are
We
things to be
take
taken
our
very seriously, and, human life is very important.
right, no, 100%, right? And what I have found on an outpatient basis is individuals aren't trained
Mhm.
competently and confidently to treat somebody who's got suic who's suicidal or who has suicidal ideations, right? But just because the individual has suicidal ideations doesn't mean that it's also a requirement for psychiatric inpatient, you know,
Right,
hospital. If they are, you know, I think it's there's got to be like three to four different criteria. Are they, actively having suicidal ideations? Do they have a current plan? Are they
and
actively
yeah,
acting or trying to act on that plan? Right. Those
right,
are, and I think there might be another criteria in there, but those are the three primary criteria that warrants a serious need and a serious look at psychiatric inpatients, hospitalization and stabilization on a crisis unit of some sort across the board, regardless of country and state, regardless of age and diagnosis. But if they're just having a suicidal ideation, like you said, you know, it can be something that my outpatient provider can
this can
handle.
pop for a little bit. It resolves very quickly. I have a bad thought for an hour and I talk about it.
Right,
I forgive myself because these are things that are passing and do not merit, 24/7 care.
right. Right. And that's where informed consent comes in at. And, I think informed consent involves more than just a psychiatric diagnosis. It involves more than just that. It also involves, and I'm going to pick on me for an example, it involves my training and my background and my history and my knowledge and my, my expertise. Because if I am, if I feel incompetent or, you know, yeah, let's say I feel incompetent or I don't feel adequately like, okay, if I'm doing an assessment on you, Ellen, right? If I shouldn't just up and say, okay, you need inpatient hospitalization.
Mhm.
Uh, you know what? Let me get a second opinion here. I want to bring my another provider in. I want to bring my supervisor in. I need to do a case consult real quick, just to make sure because when I put you on a psychiatric inpatient unit, and let's say it's a locked ward where, yeah, I think most states say it, approximately 72 hours on a locked unit. I think that's base minimum here. I
That's
might be wrong, right? But when I put you on a locked unit, your rights are taken away. And I don't mean like all of your rights. Like, no, 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 no. I mean like you do not have the freedom to leave that unit on your own. You have to have a medical order to leave, right?
exactly. You've lost your independence. You've lost your free will. I was on a hold at 16, and my parents supported me leaving the psychiatric hospital against medical advice because the psychiatric hospital was profoundly detrimental to me. I went in after my only suicide attempt at 16. And, in the psychiatric hospital, the children, I learned from other kids how to, use dental floss to harm myself. The kids, encouraged each other to self-harm. I was on lounge confinement and watched 24/7. I was put on a hold before I could leave because, my condition deteriorated significantly while I was in the psychiatric hospital. So being on a hold makes you feel like you have lost your power.
Mm-hmm. Yeah. And I think it goes into, again, informed consent, like, right? Like it's our job to inform people, right? Like if you need, like if you're mandated, court ordered, like you're involuntarily committed, that's a different story, right?
Yes.
Because, again, like you still have some form of informed consent there, but like that's a whole different beast here, right? Like I'm not even going to touch that. I'm not an expert in that area. But in the normal general population here, like what we're describing, informed consent is still involved in all aspects of the healthcare profession, regardless of whether it's osteomedicine, whether it's neurology, whether it's psychiatry, what have you. It's still, informed consent is still a major factor here.
Yes. No, and the lack of informed consent, and the fact that doctors think that people aren't smart enough to understand the risks. So you have many people, somebody with a 80 IQ goes into a doctor, and the doctor maternally says, here are pills, and assumes that that person is not capable of making a decision. I firmly believe that if a doctor has somebody who does not seem capable of making that decision, they should see if there's somebody else in the family or a friend who could come in and make certain that person is making a decision in their wise mind as to whether or not to take psychiatric medications.
Mm-hmm. Right. I wholeheartedly second that. And for me, I think it just, when I think about all of this, there's a huge disconnect. Because, if you look at somebody with a low IQ, it automatically internalizes the ideal, well, this person doesn't understand. So therefore I don't need to explain, right? All I got to do is tell them, hey, do this. It'll work or it'll help, right? And I'll even use my own experience here. When the day before surgery, my medical provider came in and he was like, hey man, I want to cut right here. And I'm like, oh, can we change the location of the cut? Because I have a tattoo there, right? and he was like, yeah, I'll move it up or whatever. And I'm like, all right, cool. So
right. Well, it's good you not asked the question. I had a doctor who was responsive and didn't say, I don't care.
Right. And so, because I told him, I'm like, now if you can stitch my tattoo back together, make it look cool, I'm fine with that. And he was like, nah, I ain't gonna do that. He's like, that's not me, right? And so he was like, yeah, I'll move it up. And then he also said, listen, less than 0.02% of the time, major medical stuff happens when people are on a table. And he said, and if that were to happen, he's like, and again, it's rare, but if that were to happen, I'm gonna cut you wide open from top to bottom. And he said,
that's very different. If you're in a death situation in the moment.
Right. Oh, right. But he still explained to me the situation, the stats. He was like, I have to tell you this because, I'm going to be doing the surgery. And very interesting, thank goodness nothing happened. He didn't have to cut me wide open, but it was one of those things. It was still part of the informed consent process. I could also, and it's very rare when you do kidney donation and kidney surgery, very rare that somebody medically codes, but at least he still covered the stuff. And I told my dad who was there, I'm like, hey, this is my mentor's number. He knows what some of my thought processes are, what some of my wishes are. So in the event you feel like you can't make a non-emotional decision, he'll tell you what my wishes are, right? And so but it was all about that informed consent where they knew what I wanted. They asked me, and I also made it known to people who were there that in the event something were to happen, this is what some of my thought processes are, right? But they covered every piece of that informed consent because it's major surgery, right? Like you just don't take a kidney out and everything's good. It's major surgery, therefore major informed consent. And that level of informed consent should be similar across the board with many other things.
Right. And any procedure, any medical procedure, you should have a sit down and know about the risk, unless you're under emergent constraints. If you are going to have a cancer procedure, you should know all the risks of chemotherapy before you decide to do chemotherapy, because there are always options. There are always options for different types of treatments. Yep. And some people prefer to have more radical treatments, and some people prefer less. But one thing I've learned is having a positive outlook is very important for your prognosis for any mental health condition or any physical condition.
Right.
If you have cancer, you do better if you have a positive outlook. And it's the same thing with withdrawal or any other mental health condition.
Right. No, absolutely. So let me ask you this. What do you feel like is the biggest barrier, right? Or maybe a couple of barriers to, behind the lack of informed consent coming from healthcare professionals? I have to ask
I
because
firmly believe this is big pharma. This is
big pharma.
big pharma. Yeah, big pharma. Big pharma, the funding issues. This is the cheap solution. Doctors are given, big pharma pushes them to prescribe psychiatric medications. You have 15 minutes. What the hell are you going to do? You can't do therapy. You medicate somebody in those 15 minutes. These are the cheap solutions. We need to have greater funding for mental health care because our society, historically has not prioritized mental health care and funding for mental health care. Things are better now than when I was a child, but it is still, there is not parity.
Mm.
The benefits for mental health issues are often not as great as those for physical conditions.
Mm. I couldn't agree more. I couldn't agree more. I think, big pharma is a major factor into a lot of the issues that we have in healthcare. And here's the problem, right? People get mad at me all the time when I say this, and that's okay. I don't care if you
That's
get
okay.
them pissed off and mad. Hey, it's better to be pissed off than pissed on unless you like a golden shower, right? So, and I had a friend of mine that used to get mad at me because they would disagree. And I'm like, well, you can't disagree with over half of America. But over 75% of Americans say that we do not have quality health care and they do not receive the level of care or the type of care that they need and deserve.
Mhm.
That's not me saying this. That's me agreeing with the American people that says over 75% of Americans, right? That's not me bringing this up. I'm not making this number up. You can Google it, right? Like you can Google it. You can Brave search it. You can Safari search it. You can ask Siri. You can Grok it, Gemini. It doesn't matter.
Mhm.
You're going to get the same answer.
Yeah.
Whichever search you do, you can read research articles on this. Over 75% of Americans believe that we have a broken and total disaster healthcare system because it doesn't meet their needs.
Disturbing. 75% of us think that our healthcare system needs to change. That means there need to be change. It's just, how do we get this accomplished? And
Right.
I think there's more, I don't advocate anything political, but, RFK is doing more work on informed consent and spreading awareness about psychiatric medications. And, at least there are people now spreading more awareness that pills are not always the best solution.
Right. Now, like RFK or not, I don't get political on this thing.
Yeah, I'm not political.
I like some of the stuff he's doing.
There's some things, I will admit that there's some things that he says that are about informed consent.
Oh yeah, no, 100%. And that's where, I actually really like that idea because we have a lack of informed consent in many areas. And I'm not saying I support him or not support him. That's neither here nor there. I don't give a crap for politics. It's not my deal. Because we've had some great people in his position. We've had some terrible people in his position since that position has been created. And so, for me, I think it just goes back to, what are the barriers or what is the reasons that support the fact that over 75% of Americans agree we have a terrible and total disastered healthcare system because they don't get the quality of care that they need or deserve, right? What are the reasons behind that? And what are the solutions to those reasons? Once you identify the reasons, you identify the solutions. I truly believe that. And for me, informed consent is a huge barrier, is a huge reason behind that number. You also have many other reasons, lack of trust, incompetent providers. Like you have many, many reasons.
Right.
So how do
There
we
are
bring that number
many
down?
competent providers, but there are many incompetent ones as well.
Right, right. No, absolutely agreed. I've worked with many providers who they are phenomenal at what they do. I've also worked with many providers who I'm like, I don't know if I would put my health care in their medical decision capacity, right? I don't think I would do that. The people some of the providers I work around now, I mean, I absolutely love them. They are phenomenal. They are competent, and I love them. I trust their decision making. One of the things that I love about one of the providers I work with, uh, and he has said this, and it really threw me for a loop because I never heard a medical provider say it
Mhm.
except for him. And then I started paying attention to the other ones. I'm like, wow, it makes sense. But he made a comment. He said one time, and he said, if you take a psychiatric medication and then you take a vitamin that does the same thing as a psychiatric medication can do, plays with the chemicals, right? And like they got real in depth with things,
Yeah.
right? My brain, I'm like, whoa, dude, that's cool, right? But they went into how different things work internally in the brain, the body, and all of that. And they said, if this vitamin, which is natural, is going to do the same exact thing,
Hmm.
similar mechanisms and everything,
Hmm.
like the psychiatric medication is going to do, why would I prescribe a psychiatric med?
Right. Well, firstly, often that psychiatric medication is covered by insurance and the vitamin might cost you more. And that's unfortunate. But yeah, no, doctors will jump to the prescription instead of the vitamin. I mean, why not try a vitamin before you go to take a benzo?
Right. Yeah. No, 100%. And I'm not a medical person. I'm a therapist, right?
No, I'm
But
not medical
but
either.
but I am, when I heard that doctor say that, I'm like, whoa, this quality of care that is looking at the patient as a person and a human being, that is putting the needs of the person ahead of the insurance and big pharma. Like I mean, just all of these. I can keep going down that list,
Yeah.
right? But that's what I desire to push
Mhm.
via this podcast and even in the healthcare industry, because that goes back also to informed consent. Right? These providers will sit down and tell these individuals. I've seen many providers sit down and tell individuals, I don't, I don't think this, because if I do this, you're looking at some pretty severe things. But this thing right over here is healthier, it's better. You still got some side effects, but I would like to encourage us to start here first before we go here. And I've seen many providers do that.
Mhm.
That is the most appropriate way, I think, anyways.
Yeah.
Again, in my mental health capacity here, I'm not a medical person, so I can't get medical advice, right? But I've seen that happen more often than not, and I'm like, why not do what many of these providers do? Because they're giving informed consent. They're also helping the individual make a healthier medical clinical decision, and they're making an educative decision for themselves.
Mhm. Right. I mean, giving people time, if somebody pressures you to make a decision in the moment, that's disturbing. You should always feel, unless we're in under emergent circumstances, you can say, can I take a day? Can I think this through to know what would be best for me personally? Because
Yeah,
I think there's a lot of pressure in the healthcare system to make decisions immediately.
no, absolutely. And feel free to even ask, what are some other options, right? Like, feel free to ask that. Like, what are some other options that I can do besides going with this first? Is there anything like a step up plan, right? Or whatever. Some people call it a step up plan. Some people call it a phase up plan or whatever, depending on what area and what your healthcare, what the healthcare field is. Just like, when to go from a inpatient unit to a residential treatment program to a comprehensive outpatient program to an intensive outpatient program down to just general normal outpatient services. That's a step down plan, right? Like you're giving people from the most restricted to the next least restrictive to the next least restrictive. Like it's a step down plan,
Right. There
right?
should be steps. You shouldn't go to the most extreme option first.
No, 100%. There should be options on the table. Again, unless there's like medical emergency, severe critical emergent where it's harms itself or others, right? Like we're not talking about those areas, right?
No.
Like that's a different part of the healthcare field. They got different regulations, different,
Right, and that's fine. Those are emergent circumstances.
Yeah, no, 100%. We're talking about just in a general manner here. I got a friend of mine who just got diagnosed with cancer. And literally, he went through 1,000 questions, and he's been in recovery for about 2-3 years now. And he even asked, he was like, "Well, listen, I've been doing some research, doc," and he was like, "There's some type of cannabinoids that not the stuff that gets you high, like you don't like not smoking weed or whatever to get you high." But he was like, "Listen, there's some various cannabinoids that they have found in Asia or wherever, Europe or wherever, UK, they've shown in research to help fight this stuff." And he was like, "Hey, what about this? What are your thoughts on this?" And the doctor gave him, the informed consent, right? It was informed consent. A question was asked, education was provided. And the medical provider said, "I don't think it is the best option because we're past that point. Like we're past that. We're talking about it is already developed and you have lumps, right? Or metastasized, I think is the word. Like we're past that point of where this right here would generally work. We're not telling you to not do it, but at this moment we're past even encouraging, being able to medically encourage this." And he lives in a state where it's where I think medical marijuana is legal. And so like the doctor did say, I mean, just straight up told him, like for general purposes, 100%, yeah, like I would say, yeah, but we're past this. Like we need chemo, we need radiation, like we need all of these things because it's, all of the stuff that he's got right going on. And I mean, he literally asked a question though. The cancer doctor explained to him.
Right.
And informed him. And that's what healthcare should look like.
What should happen? Healthcare has a place. I have at points avoided the healthcare system because I was afraid that I was going to be told I was a psychiatric case. I minorly strained my leg the other day, and I was somewhat reluctant to go to urgent care because I was afraid that they would tell me that it was in my mind. And in fact, I had a minor muscle pull. So I resist seeing doctors because I'm afraid they're going to tell me that I have mental health issues when things are physical. I think that is all too common, that people who are struggling with mental health challenges are afraid of the medical system.
Right. And I definitely 100% agree. I mean, there's so many things that are, that need to be fixed in the healthcare system. Informed consent is one of them. People, one of the reasons we do this podcast is to help people feel like they have a voice, right? It doesn't matter what country you're in, what state you're in, and no, listen, it might sound like we're being cynical, right? I don't want you to think that we're being cynical to healthcare. I work in healthcare, Miss Ellen works indirectly in healthcare. And so like, there's a respect. We both respect and love and enjoy what we do. Part of what we're doing here, and I think one of the things I hope people, you take away as you're watching and listening to us, going back and forth is, you have a voice, use it. I don't care who the medical provider is. I don't care what hospital it is. I don't care what field of the healthcare system you're in, whether it's oncology, psychiatry, whether it's neurology, whether it's, osteo, whether it's renal, doesn't matter what it is, right? Doesn't matter. GI is another one, and there's so many things out there, ENT, right? You have a voice. Use your voice, ask questions. If you are unsure, bring a friend, bring somebody, bring a nurse for that matter. Nurses, or if you have a friend as a nurse, say, hey,
Patient
I'm going.
advocate. There's
Right,
somebody there because everybody has a voice.
right,
Right. You should not be told that you don't have a voice. Any doctor who tells you this is the only solution, look elsewhere.
right. Right, because healthcare is needed. Healthcare is needed. It doesn't matter if it's psychiatry, whether it's mental health therapy, whether it's cancer, whether it's blood or oncology. All of this. We all need healthcare. We all need it. Doesn't matter. You have pregnancy. If you're a woman and you have delivery and birth, and I think they what OBGYN is what they call it. I'm not a woman's expert here, but like you have options. You have a voice. Use your voice. Advocate for yourself. And like she said, bring a patient advocate.
Yeah.
There are people that are coaches or patient advocates that literally will work for you for little to nothing, right? Like
Right.
a
I
lot
think
of
in
them
a
do it
hospital,
free.
you could probably get somebody even for free if you have no means to make
Right,
certain that you're making decisions in your wise mind for major things.
right. 100%. Yeah. You have some organizations call it a patients' rights committee. I think, and that'll vary depending on organization, field, state, et cetera, et cetera. But in most healthcare organizations, you do have that type of committee
Mhm.
that is supposed to, most organizations, I think most states now have that type of law set up where there's a patient rights committee set up. And so you have a right to make a complaint, have your voice heard, have somebody in the room with you. And if they don't have a patients rights committee, take a friend, take somebody who's been there, take somebody who knows, right? Like, for sure. We're not cynical against healthcare.
No, yeah, no, I mean, healthcare, you should definitely seek out mental health, physical health treatment. Doctors are helpful people. I firmly believe you need to be careful in who you select and take the time to ask questions and make informed decisions.
100%. Absolutely 100%. Could not agree more. I could not agree more at all. And so I know we're pushing a little bit of time here. I'd love to keep this conversation going for another 2, 3, 4 hours. I love everything we're talking about because this is part of my passion, right? Like I'm a very passionate guy. Some people call it crazy as hell. I call it being full. uh, what is one thing you hope people can take away from watching or listening to this?
Firstly, that you're never without choices and that you can always ask questions. You shouldn't be afraid to ask a medical provider questions. There are always options in the medical, in mental health and in physical health. If one doctor isn't right for you, there are other options for you.
I love it. If people want to hire you as an attorney, maybe have you on their show, maybe, reach out to you as a mentor, anything of that sort, how can they contact you?
Okay, well, I have a webpage. It's ellenlubensky.com, ELLENLUBENSKY.com. I post public on LinkedIn, Instagram, Facebook, TikTok, and YouTube. I do lives currently at 8:30 a.m. on Eastern Daylight Time on Thursdays on LinkedIn. I do a live on Facebook weekly and 2 lives on TikTok weekly. I can't give, I can get, provide support. I can't give medical advice. But feel free to reach out to me because these are things that I firmly believe in, and I hope that others ask the questions that I did not ask.
Absolutely. Um, and most important question here is, what is your call to action?
Um, you know, ask. Ask. Do not be afraid. Do not. I thought that I would lose my job if I spoke publicly. There are protections. The Americans with Disabilities Act. There are legal protections that protect you and make it so you don't have to hide. And you can always reach out for help because I didn't think I could reach out for help. And there's
Mm,
always help.
Absolutely. All right, folks, you heard it best here. If you got upset because of what we spoke about, because we spoke about the goods and the bads of the current state of the healthcare system, that's all right. Like we said earlier, over 75% of Americans agree that we have a total and disaster and broken healthcare system. It needs to be fixed, right? I don't make that number up. Miss Ellen don't make that number up. We spoke about some of the barriers to and the reasons why over 75% of Americans say the same thing. That being said, talk to your talk to your therapist, talk to your primary social worker, talk to your medical provider. Reach out and go to if you need to go to a crisis center because you were triggered, like utilize your resources. Seriously, man, like utilize your resources. With that being said, thank you all for checking in. Miss Ellen, thank you for coming on, and I look forward to having you on again, just so you know.
I hope so.
Absolutely.
Can I have the link to the show?
Absolutely, 1,000%. I will send it to you as soon as we are done.
Perfect. I greatly appreciate the opportunity to join your show, and I hope to come back in the future.
Absolutely. Thank you. Yes, ma'am. I look forward to having you on again.